Welcome to Pharma Center. Today we are going to see detailed view about drugs acting on autonomic ganglia. If you are not subscribed this channel, please subscribe it. So acetylcholine is the primary excitatory neurotransmitter in both sympathetic and parasympathetic ganglia. Drugs can act on sympathetic and parasympathetic ganglia, producing either stimulation or blockade. Ganglionic stimulants have limited therapeutic application, and ganglionic blocking agents are effective in the treatment of hypertension. Now coming to ganglionic stimulants. Though the ganglionic stimulating agents have no therapeutic use, they find use as experimental tools. So these are the drugs which are used as ganglionic stimulants. We can see it one by one. Classification. First classification is selective nicotinic agonist, and second classification is non-selective or muscarinic agonist. Now coming to selective nicotinic agonist. So nicotine in small dose act as ganglionic stimulants. Lobelin, dimethyl phenyl piperazinium, that is DMPP, and Tetra methyl ammonium, that is TMA, and varenicline. Now coming to non-selective or muscarinic agonist, acetylcholine, carbachol, pilocarpine, anticholinesterases, and MCN343A, that is selective muscarinic M1 receptor agonist. We can see the mechanism of action of ganglionic stimulants. Ganglionic stimulants such as nicotine, lobelin, dimethyl phenyl piperazinium, that is DMPP, it combines with ganglionic nicotinic receptors on the postsynaptic membrane. This leads to membrane depolarization, influx of sodium and calcium ions, generation of a fast excitatory postsynaptic potential. This leads stimulation of autonomic ganglia and a complex pattern of mixed sympathetic and parasympathetic responses. We can see a detailed explanation of drugs. First coming to nicotine. Nicotine is a principal alkaloid obtained from the leaf of tobacco plant, that is Nicotiana tabacum, and it acts as an agonist on both NN and NM receptors and actions of nicotine. Sympathetic as well as parasympathetic ganglia are stimulated, but larger doses causes paralysis, persistent depolarization, and ganglionic blockade. That is stimulation of nicotinic receptors at neuromuscular junction. So neuromuscular junction short form is NMJ. It leads to contraction of skeletal muscle followed by paralysis. And it initially increases the salivary and bronchial secretions followed by decrease in these secretions. And nicotine stimulates the release of adrenaline from adrenal medulla, and it produces antidiuretic effect due to a release of ADH hormone, that is antidiuretic hormone, and it activates nicotinic receptors on the plasma membrane of the cells of adrenal medulla. This leads to exocytic release of epinephrine and norepinephrine. And nicotine directly stimulates respiratory, vasomotor, and vomiting centers of the medulla, and it produces tremors and convulsions in large doses. Stimulation of central nervous system followed by depression, and death also occurs due to respiratory paralysis. And it is used in the treatment of smoking cessation or quitting tobacco chewing. Majority of smokers and tobacco chewers wish to quit smoking, chewing, but fail to do so because of nicotine dependence. Measures to help smokers quit is counseling and motivation. The goals of pharmacotherapy in the treatment of smoking cessation involves to reduce the craving for the satisfying effects of nicotine and to suppress the physical withdrawal symptoms of nicotine. The drugs currently utilized for the above goals are nicotine replacement, and partial agonist of alpha 4 beta 2 NR partial agonist, that is varenicline, and antidepressants such as bupropion. So these are the drugs which are currently utilized for the above goals. And acute nicotine poisoning. The symptoms of acute nicotine poisoning includes salivation, vomiting, diarrhea, and cold sweat, rapid respiration and rapid pulse, incoordination and respiratory failure. So these are the symptoms of acute nicotine poisoning. And chronic nicotine poisoning. The symptoms includes gastrointestinal disturbances like indigestion, dyspepsia, nausea, and gastric ulcer. Circulatory disorders like palpitation, cardiac arrhythmias, and myocarditis. Neurological disorders like neuritis and amblyopia, and bronchial carcinoma, which is common in smokers. So various dosage forms of nicotine includes nicotine transdermal and nicotine chewing gum. Now coming to the drug lobeline. It is a natural alkaloid obtained from the dried leaf of the herb Lobelia inflata. It resembles a nicotine in pharmacological action. It stimulates respiration by direct central action and also by increasing the sensitivity of respiratory center to carbon dioxide. In the form of tincture, it was once used as a bronchial antispasmodic. Now coming to the drug tetramethyl ammonium, that is TMA, and dimethyl phenyl piperazinium, that is DMPP. So these two drugs are synthetic quaternary compounds and ganglionic actions are similar to nicotine. But ganglionic stimulations are not followed by paralysis, not satisfactorily absorbed from gastrointestinal tract. So that's all about ganglionic stimulant. Now we can move to a next topic, that is ganglionic blocking agents. Ganglionic blocking agents. So these drugs block transmission in both sympathetic and parasympathetic ganglia. They do not affect the conduction of impulses in the preganglionic or postganglionic nerves in both sympathetic and parasympathetic, and they do not prevent release of acetylcholine on preganglionic nerve stimulation. It produces ganglionic blockade by occupying receptor sites on the ganglion cells. Classification of ganglionic blocking agent: competitive blockers and persistent depolarizing blockers. Competitive blockers has three subdivisions. One is quaternary ammonium compound. Amines involves both secondary and tertiary amines, and monosulfonium compound. Now coming to quaternary ammonium compound, hexamethonium and pentolinium. Amines, mecamylamine and pimpidine. Monosulfonium compound, trimethafen, camphor sulfonate. And persistent depolarizing blockers. In large dose, nicotine act as ganglionic blocking agents, and in large dose, anticholinesterases also act as ganglionic blocking agents. Now we can move to a pharmacological actions of ganglionic blocking agents. It blocks both sympathetic and parasympathetic ganglia. That is, blockade of sympathetic ganglia decreases the sympathetic peripheral tone and fall in blood pressure, that is hypotension and pooling of blood in veins, and it decreases venous return and cardiac output. Through the blockade of parasympathetic ganglia, it achieves, that is, it produces mydriasis, cycloplegia, decrease in gastric secretion and intestinal motility, and sweat secretion, and interference in emptying of bladder. The competitive ganglion blockers were used in 1950s for treatment of hypertension and peptic ulcer, but have been totally replaced now because they produce intolerable side effect. Now we can see one by one drug. First drug, trimethafen. It is an ultra short acting ganglion blockers, and it is occasionally infused through IV, that is intravenous, to produce controlled hypotension in hypertensive emergency due to aortic dissection. Next drug, mecamylamine, alone or in combination with nicotine patch, being tried for smoking cessation. It blocked the reward effect of nicotine. Constipation occurred in many subjects and it is not an approved drug. At present, there is no clinical relevance of ganglionic blockers. Absorption, fate, and excretion of ganglionic blocking agents. Quaternary amine ganglion blockers are not absorbed from gastrointestinal tract, but secondary and tertiary amines are well absorbed orally. Distribution of quaternary amines is limited and they do not cross blood-brain barrier, that is BBB. But secondary and tertiary amines can cross blood-brain barriers and it is excreted almost unchanged in urine, unchanged by the kidney and in urine. Therapeutic uses of ganglion blocking agents. It is used as antihypertensive agents and occasionally used to control excessive secretion and motility of gastrointestinal tract. And adverse reaction, postural hypotension and syncope due to sympathetic blockade. Due to parasympathetic blockade, it produces mydriasis, cycloplegia, dry mouth, constipation, urinary retention. And secondary and tertiary amine produces adverse reactions such as central effects like depression, mental confusion and mania. If you like this video, press like button and share to your friends. Thank you.